I'm going to give a subcutaneous injection to a patient today. So first thing, I'm gonna wash my hands, and I'm going to compare physician order to the medication record to make sure it was transcribed properly. Leanne Schmidt, date of birth matching, hospital ID number matching, she's allergic to penicillin. On March 22nd, Dr. Arlanda Torres prescribed her digoxin. So I have digoxin here that was transferred to the MAR on March 22nd, 0.25 milligrams, 0.25 milligrams. It's gonna be given PO every morning at 8 o'clock. And the other order is heparin. I have heparin here and heparin there, 5,000 units, 5,000 units. Needs to go sub-Q once daily at 8 o'clock. So orders were processed properly, and the nurse that processed them was Jessica Green, and I have her initials here. Next thing I'm going to do is I'm going to check medications for the first time. So I have Leanne Schmidt. I'm gonna give her heparin. It is 10,000 units per 1 meal. I have an order for 5,000 units, so I should have enough. It's gonna go sub-Q. It says it can be given sub-Q once daily at 8 o'clock, and it's April 6, hasn't been given yet. Okay. Next, I'm going to do my medication math to figure out the size of the syringe. So I need 5,000 units, and I have 10,000 units over 1 mil, so I need 0.5 mil. So I can get either 3 mil syringe or 1 mil syringe. I'm gonna go with 3 mil syringe because I have half a mil mark on this syringe. So I'm going to swab the vial. Okay. And while it's air drying, I'm going to set up the syringe. Because it's a vial, I don't need a filtered needle. I'll put some air into the syringe, into the vial, and then I'm gonna get 0.5 mils. Okay, so I have 0.5 mil here. Now I can do my second check. So for Leanne Schmidt, medication I have here is heparin. So it is heparin, 5,000 units. So I have 10,000 units in 1 meal. So I'm giving her half a meal. It is gonna go subcutaneously. I can give it subcutaneously once daily at 8 o'clock, April 6th. Nobody hasn't given it yet. And I can do my last check. Leanne Schmidt. The medication is heparin, 5,000 units. So I have 10,000 units in 1 meal. So I need half a meal. That's what I have. It can go subcutaneously once a day at 8 o'clock. April 6th hasn't been given yet. And for subcutaneous injection, I can use 25 gauge needle. Let me go to sharps. So I have my needle, the sticker to check the ID of the patient, and alcohol swab and the gloves to go to the room. So when I came to the room, I'm gonna wash my hands first. Good morning, Cleanne. My name is Victoria. I'm going to be your student nurse today, and I'm supposed to give you heparin injection. Is it okay with you? Thank you. So first I'm going to swab the area. So for subcutaneous injection of heparin, I'll choose lower part of your abdomen, at least 2 centimeters away from the belly button. So I'm gonna swab it. Okay. And while it's air drying, I can tell the patient that medication is a blood thinner, so to prevent blood clots in her body. And before I do anything else, I need to check her ID. So with my sticker, I'm gonna confirm her first and last name, which is Leanne Schmidt. I'm gonna ask you for the date of birth, and it's supposed to match. And she's allergic to penicillin, so I can ask if she is allergic to anything else. By that time, her area is dry, so now I can open my needle. I'm gonna pinch the skin, stabilize my syringe with my pinky, dart, and slowly inject the medication. Recap the needle. Goes in the sharps, no pressure needed because it's subcutaneous injection. I remove my gloves, wash my hands. Thank you, Leanne. Here's your call bell. If you have any concerns, please use your call bell, and I'll see you shortly. And I'm going to document that I gave you heparin to Leanne Schmidt, 5,000 units at 8 o'clock. So my initials here, and then I'm gonna write my full name under the nursing signature and designation. And I'm done.